Good morning, everyone. My name is Celeste Kinsey. I am Canadian, and I work for the Canadian government, for the International Development Agency, and I'm based in Maputo, Moçmabic. I've been in Moçambique for about 2.5 years, and I'm here today representing, the working group in the SWAP on public financial management, which I am the chair of. But obviously I have two hats in that Canada is a donor to the health sector in Moçambique. We are also then members of the SWAP, and my presentation is sort of from my perspective of engaging in the SWAP, but during the question period I'm happy to give some reflections as a donor as well. The presentation this morning was very good for making me reflect on sort of the different roles that we have. So, here we go. Financing for health in Moçambique. Moçambique is a low-income country. It relies extremely heavily on external aid. Overall, in Moçambique, the government, about 50% of the national budget relies on external resources, so from donors. In the health sector, that's even higher. It's more than 70%. And the first slide here is intended to give you a sense of sort of the different types of financing that exist, and then volumes of those. I've divided it's estimates, so they're not exact numbers, because the numbers are problematic. Also, I've divided it very simply. That which government more or less manages in terms of implementing and spending the money, and that which is managed and spent by other actors, be it civil society, donors directly, or private foundations. So it's probably more simple than, it looks more simple than it really is, but it gives you an idea. Annually in Moçambique, the government spends about $150 million a year. I will come to that. It's about 7% of the national budget that's allocated to the health sector. There's a sector budget support mechanism known as ProSaúde. Right now, it's about $75 million, and I will come to sort of some more detail about that as well. It's sector budget support in that it's extremely flexible, can be used for, excuse me, can be used for any expenditure as long as it falls within the health sector strategy. It's managed by government, passes through national systems, and uses all, sort of at every level, is based on national systems. Vertical funds, which we heard a bit about this morning. Here, what this represents is the Global Fund, which is a very large donor to Moçambique. There are 7 different grants that should total about $75 to $90 million a year in disbursements. In 2009, the Global Fund did not disperse to Moçambique. So although this is an indicative number, in 2009 it was a 0 when they planned on receiving it. We'll come to talking about that. And then we have projects. For the last 3 to 4 years, there's been a big push in Moçambique to get people to put projects on budget. While it says managed by government, that would mean that funds would flow through government systems even if they go to an NGO, and it's an NGO project. But basically to try and register the activity in the sector. What is happening? How much money is there? And who's doing what? That's about $20 million a year. On the other side, we have that which is managed just by partners, which means it never comes anywhere near government systems. It's not on budget, and it's not included in their plans, so also wouldn't be in their annual reports or any of that kind of work they do. It's estimated about $330 million a year in projects, a significant portion of which is funding from the USA. That is, was described this morning as a vertical program, and it is a vertical program. It's largely the President's Initiative for HIV, PEPFAR, and it's actually changed. This 250 this year, I've been told, or in 2011, it should be about $300 million for PEPFAR. That's spending on HIV alone. There's about another $80 million in projects. That's a combination of your more typical bilateral donors, but then also your emerging donors, India, China, very big in Mozambique, lots of political influence, trade relations are growing, and it's changing the envelope as well. Here when I have private, I mean, I'm talking about private foundations, the Clinton Foundation, which is very active in Mozambique, not out-of-pocket spending, which Monty was speaking about before. Out-of-pocket spending in Mozambique, in terms of its contribution to the health sector, is minimal at best and very poorly recorded. So what that would be is wrapped up in what is the state budget. It doesn't even really hit the radar screen in terms of volume. So what we can see is that it's about $660 million, 22 million people, health services in a country that is geographically it's very large, very diverse, culturally very diverse. There are 10 provinces, and very poor infrastructure. Resources are not sufficient to meet the needs of that population, and furthermore, very, very fragmented. I did just a couple of little pie charts so that we can talk about what hits the radar officially in Mozambique, and then what hits the radar sort of unofficially. This is the official one, what would be on budget. If you look at what's registered on budget, the state budget would contribute almost half of the resources in the health sector. ProSaúde, the sector budget support mechanism, is about 23%. Vertical funds, being the global fund, is about the same size as sector budget support. And then your projects are smaller. When we then move to the total financing that's there, keeping in mind that the projects that are managed, the U.S. government doesn't, 100% of that money doesn't go to Mozambique. A lot of it is lost in administration because they hire partners to implement their projects. The picture is very different when you put the entire package together. You see that the state is barely covering not quite a quarter of the spending. The sector budget support mechanism that takes up so much time in the swap and so much energy is actually just a small piece of the puzzle. And they are flexible resources, but you can only do so much when the percentage is small. The global fund as well is small. 11% it would be. Your projects on budget, your projects off budget are big. That with which the government cannot, can perhaps influence, but definitely can't control. And then you have the U.S. government, which is funding a significant piece of the health sector in Mozambique. And that should, I think it's an important context because the political landscape and in terms of relationships, bilateral relationships, is very, very important. Mozambique there are more than 40 donors to Mozambique. 19 of them provide general budget support. 14 provide sector budget support. It's a highly harmonized aid environment. It's one of the darlings that has come from Paris, I think. But when you look at this and you see, okay, who are the real actors? The U.S. is not, did they even sign the Paris Declaration? I don't think that they did. But they aren't known worldwide for adhering to its principles. However, they're still one of the biggest actors in the sector.